United States fire departments responded to an estimated 1,602,000 fires. Total calls amounted to 23,251,500. These fires resulted in 3,675 civilian fire fatalities, 17,925 civilian fire injuries, and an estimated $10,672 million in direct property loss. A civilian fire death occurred every 143 minutes and a civilian fire injury every 29 minutes. Home fires caused 3,030 civilian fire deaths, which is 82% of the total civilian fire deaths. Fires accounted for 7% of the total calls. False alarms constituted 9% of the total calls, while aid calls, such as emergency medical services, accounted for 62% of the total calls. The data highlights several key aspects of fire incidents and emergency response. Firstly, the sheer volume of calls received by fire departments indicates the breadth of their responsibilities, extending beyond just fire suppression to include a significant proportion of medical and other assistance. Secondly, the high percentage of home fire deaths underscores the importance of fire safety measures in residential settings such as smoke detectors and fire escape plans. Thirdly, the frequency of false alarms points to a potential area for improvement, perhaps through better alarm system technology or public education on alarm maintenance. The financial impact of fires is substantial, with billions of dollars in direct property loss. This figure emphasizes the need for effective fire prevention strategies and building codes to minimize damage. The time intervals between fire-related casualties are also concerning, suggesting that rapid response times and effective medical care are critical for improving outcomes. Furthermore, the comparison between home and non-home fires reveals that residential fires are disproportionately deadly. This could be attributed to factors such as sleep-in errors, lack of awareness, or inadequate safety measures. The prevalence of aid calls highlights the evolving role of fire departments as multifaceted emergency responders. This shift requires additional training and resources to handle a wide range of medical and rescue situations. Finally, the relatively low percentage of calls that are actually fires suggests that fire departments are increasingly involved in non-fire emergencies. This trend may require a re-evaluation of resource allocation and training priorities. The data provides a snapshot of the fire and emergency landscape in the United States, offering valuable insights for policymakers, fire departments, and the public. By understanding the trends and patterns, stakeholders can work together to improve fire safety, reduce casualties, and enhance emergency response capabilities. Effective strategies should focus on prevention, education, and preparedness to mitigate the impact of fires and other emergencies. These strategies can include, firstly, public awareness campaigns to promote fire safety practices, secondly, stricter enforcement of building codes to ensure fire-resistant construction, thirdly, investment in advanced firefighting technologies and equipment, fourthly, enhanced training for firefighters and emergency responders, fifthly, community-based programs to educate residents on fire prevention and escape plans, sixthly, collaboration between fire departments, healthcare providers, and other emergency services, seventhly, development of early warning systems and rapid response protocols, eighthly, research into the causes and patterns of fires to inform prevention efforts, ninthly, regular evaluation and improvement of fire safety regulations and standards, and tenthly, promotion of smoke detector use and maintenance in all homes. By implementing these comprehensive measures, the United States can strive to reduce the incidence and impact of fires and other emergencies, ultimately saving lives and protecting property. The emphasis on prevention, preparedness, and rapid response is essential for creating safer communities. The importance of accurate and timely data collection cannot be overstated. Reliable statistics are crucial for identifying trends, assessing risks, and evaluating the effectiveness of interventions. By continuously monitoring fire and emergency data, stakeholders can make informed decisions and allocate resources strategically. The data also underscores the need for a coordinated approach to fire safety and emergency management. Collaboration between government agencies, private organizations, and community groups is essential for addressing the complex challenges posed by fires and other disasters. By working together, stakeholders can leverage their resources and expertise to create more resilient and safer communities.